Hello, everyone, and thank you for calling us here today to talk about Medicaid expansion in Georgia. We understand that Medicaid expansion is becoming more popular in your state, but that you're facing stark opposition from some members of your party that you need to consider. What we'd like to accomplish today is to lay out some options, talk through some of your party's concerns, and offer our informed opinion about what's best for Georgians moving forward.
As you all know, Georgia is one of the 12 states that has not fully adopted Medicaid expansion. Georgia Medicaid is currently only available to pregnant women, children, retirees, and those who are legally blind or disabled. Georgia's uninsured rate of 13.7% is the third highest in the nation, with 1.4 million Georgians not having health insurance. In rural Georgia, the uninsured rate could climb to more than 25% by 2026. 90% of uninsured Georgians have income below 400% of the federal poverty level. Of uninsured individuals, 40% are white, whereas people of color make up roughly 60%. In regards to Georgia's population health status, the state falls below national averages in rankings of state population health.
To tackle some of the big problems you mentioned, we tried expanding Medicaid partially to adults 19 to 64, earning up to 100% of federal poverty line by seeking a waiver that required people to work or volunteer 80 hours a month to qualify for the coverage. But the Centers for Medicare and Medicaid Services rejected the work requirement stipulation. Our partial expansion proposal was a more fiscally responsible alternative for the state of Georgia, and that is what we want.
Unfortunately, your proposal is not a legitimate option for Georgia because CMS has either rejected or revoked a work requirement stipulation for every state that has tried seeking one so far. Given that the federal government won't budge on Medicaid work requirements, Georgia essentially has two options. Option B, go forward with the partial Medicaid expansion waiver with the work requirement removed and only expand Medicaid to individuals earning up to 100% of the FPL, or option C, adopt full Medicaid expansion. Since the federal government will cover 90% of the cost of full expansion versus only 67% of the cost of partial expansion, full expansion is actually the cheaper option for Georgia and covers more people. This is why Republican states that initially proposed work requirements like Arizona and Arkansas have gone forward with Medicaid expansion.
Full expansion may be cheaper, but it's still far too expensive for the state of Georgia. If we can't impose the work requirement to limit enrollees to bring down costs, we don't want to expand at all. It's just too expensive, and it takes away funds from public safety, education, and other infrastructure just to expand this government program. This radical plan of expanding Medicaid in the state of Georgia will literally bankrupt our state while making it extremely difficult for hardworking Georgians to receive the care they need. All we ever wanted was to experiment ways to tailor the program to our state's needs and maintain our autonomy.
In addition, a step towards a single-payer healthcare system puts bureaucrats rather than doctors in charge of the patient's medical decisions, and many Georgians will be faced with mounting bills through a required tax increase. Being law-abiding taxpayers, Georgia's working class gives so much money in taxes, specifically income tax percentage, which is up to 5.75%, to the government, only to hear that's not even being spent on things benefiting us, such as my colleague mentioned earlier. This is Georgia, not California.
We know that the costs of full expansion look overwhelming, but its actual fiscal impact differs from the sticker price for three reasons. First, expanding eligibility allows states to cut spending in other parts of their Medicaid programs. And second, it allows states to cut spending outside of Medicaid, particularly on state-funded health services for the uninsured. And finally, expansion may increase state revenues due to taxes on the increased economic activity it triggers. So in many cases, researchers have found that Medicaid expansion generates enough savings or new revenues to more than offset a state share of the cost, essentially eliminating the cost argument. There are also options to help fund the state's 10% share of expansion that don't include taxes for Georgians. For example, former Governor Pence used tobacco tax revenue and increased provider taxes to fund expansion. And you have to consider, Georgians' federal taxes already go toward funding expansion efforts nationwide. They're just not reaping any of the benefits.
Well, if we go forward with full expansion, most of the money will be going into funding insurance for people that simply aren't working and plan on relying on government funds since it's just so easy. I don't mean to blame these people, of course. I think the government has just been so lenient that it's begun to trap these people into dependency for government relief.
We understand that the goal is to have every Georgian be self-sufficient. We could offer an alternative to the work requirements, for example, an incentive for healthy behaviors. But the majority of Georgians who get Medicaid are actually working, and only 40% of Georgian employers offer health insurance. So what about the rest of that 60%? Uninsured adults make up a good chunk of rural Georgia's population. For those who are not working in this population, meeting Medicaid work requirements would be difficult because of high unemployment and low labor force participation. Many jobs in rural areas like farming, manufacturing, and retail have inconsistent hours and high levels of involuntary part-time work. Thus, many working people in rural areas would risk losing healthcare coverage simply because they couldn't obtain enough hours of work every month. Expansion would also benefit rural hospitals through federal funding. Evidence shows that greater financial benefits for rural hospitals and a higher return on investment by focusing on increasing the amount of Georgians who are insured.
High rates of unemployment are not the only issue in rural communities. Hospitals in these same areas are struggling to provide quality care. A large proportion of these facilities are at risk for shutting down all operations, inevitably reducing access to care among these vulnerable communities. Medicaid expansion would help rural hospitals remain open by reducing uncompensated care costs.
We hear what you're saying about rural Georgia, but what about small businesses? They're an important part of our base too. After seeing the impact of Medicaid expansion on small business owners in states like in Colorado, the number one top concern for businesses is the cost of private insurance and affordability of care. The monthly premiums, the annual deductibles can be a heavy burden for business growth and the health of their employees.
Small business owners and employees have actually benefited from the ACA and Medicaid expansion. In states that expanded Medicaid, the percentage of small business employees covered by Medicaid and the number of self-employed individuals covered increased from 2013 to 2016. In Colorado, nearly 75% of private employers are small businesses, and fewer than 1 in 3 offer health insurance. This is similar to Georgia's insurance rates, where only about 25% of small businesses in Georgia offer insurance. Medicaid expansion has filled a gap for working Colorado adults whose income makes them eligible for Medicaid and whose employers don't offer health insurance. And we believe it can do the same in Georgia.
Well, we've talked so much about money, but what about health impacts? It appears that Medicaid doesn't even largely impact many people's health. According to the study produced by the Manhattan Institute for Policy Research, I repeat this verbatim. It says, the law will dramatically expand Medicaid, a program with the poorest health outcomes of any health insurance system in the industrialized world. And the ACA, despite spending over $2 trillion over the next decade, will leave 23 million lawful US residents without health insurance, according to estimates from the Congressional Budget Office.
Although changes in health status are of great interest, they are not the only important potential benefit of expanded health insurance coverage. Health insurance is a financial product that is aimed at providing financial security by protecting people from catastrophic healthcare expenses if they become injured or sick, and ensuring that the providers who see them are paid. And it does provide health benefits. For example, closing the coverage gap can offer more behavioral health treatment and services, and will also extend health insurance to more women, veterans, and military spouses who make up a large proportion of the uninsured. Finally, racial and ethnic disparities would also be addressed in healthcare access and outcomes by expanding Medicaid, as 32% of uninsured are Black and 22% are Latinx.
Once again, we believe that full Medicaid expansion is the best option for Georgia, and your constituents agree on a bipartisan basis. We hope you consider our points today and choose to deliver to the overwhelming 75% of Georgians who support Medicaid expansion. Thank you.